Okay, let's get the meeting started. November 2nd. Sorry, County Health and Human Services Board. Roll call, please.
Dale Schleter,
Yeah,
Tweed Schuman,
Here.
Dale Olson,
Here.
Chuck Van Etten,
Here.
Don Pettit,
Here.
Lorraine Bouger, Jennifer Verbornik, Carol Pearson, Sabrina Dunlap. You have a quorum.
Thank you. Certification of compliance with open meeting laws.
The meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Thank you. Everybody hear me? Speak into this thing. Okay. Meeting agenda. Changes, questions? If not, can I have a motion to accept?
So move.
So moved by
Pearson.
oh, that was okay.
And I second it, Chair.
Okay. Everybody in favor, say aye.
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 Yes. Public comments. Okay, is there anybody else who wishes to make public comments besides the two papers I have?
Anyone online?
Anyone online? Okay. Ms. Layington, you were the first.
My name's
one.
Louise Layington. I live at 7442 State Highway 70 in the Township of Ojibwa. I'd like to address the Health and Human Services Committee on two issues. One would be the Senior Resource Center and the other is the mental health clinician that we're trying to hire or mental health services in our community. I know it's budget time and I only get 3 minutes, so I can't say near as much as I want. You should be thankful. However, there was no one at any of the public budget hearing, nor any member of the Senior Resource Committee that spoke up at all to say what a good job they do throughout our community and to thank the county for their donations and to beg for as much money as you can give them. I know that there's a tight budget, but I also know that the budget needs to be spread evenly throughout our community. All of the senior meal sites closed during COVID, greatly affected by COVID. All of them have reopened except for winter, and we miss it dearly. I am single by myself. I have 4 living siblings who live by themselves. We are all in our 70s. The oldest one is 79, not going to say the name. And we use the services and we miss it. So I'm here to support the Senior Resource Center. And if you think that the Senior Resource Center isn't doing their job, or there's things that you would prefer to see, then I would highly encourage the Health and Human Services Committee to address in total the senior resource meal sites and maybe move to take it over by the county. The ADRC is already handled by the county. In the 5 counties that the ADRC handles, 3 of the counties have the meal sites incorporated with the ADRC, with the counties, and 2 do not. Those 2 are Sawyer and Ashland. I believe it is time for Sawyer to move towards incorporating the meal sites into the ADRC and the aging unit. I think that it's time. And you can ask me questions later, or if you decide to do it, I certainly can give you the details. Regarding mental health services, I know that we live in the sticks and I know that we don't have mental health services a lot. We have very little, but we do have some, but I wish we had more. And the most important one that I think that you should work towards getting is that clinician that you're talking about. So if you can't get anyone to apply for that job, would you please bump the wages up, use ARPA money, use whatever you can to get someone hired, and then take that position and make it a co-responder with the police to mental health crises in our community. I have personal experience, family members who, instead of ending up where they need to be or de-escalating because of issues with mental health, they end up in jail. And it just gets worse from there. It's not fair to have our police officers handle people who are mentally ill without the support of a mental health specialist, like a clinician or a
Okay.
co-responder.
Thank you,
And
Lori.
thanks, that's all I got to say.
Thank you.
And I reserve the right to address the board with questions or comments during the other two items on the agenda that I'm interested in. Thanks. 3 minutes, enough.
Mr. Halberg.
Thank you, Chairman. I'm Aaron Hallberg, 10335 N Duffy Road, Town of Hayward. I'm here tonight to speak a bit about the COVID-19 update, follow up on the committee meeting from last week. There's a lot of things I'd like to say as well. 3 minutes does go pretty fast. I was going to start my watch. This is really a cute thing to do when you're a kid. Somebody comes up to you and says, "You can't see me," but it's not so cute when people cover up their eyes and they're in a position of authority. And I think it's downright dangerous when you're in a position of public health to do something like that. Also, and I'm going to talk more about that, but also there's a Reuters poll released recently that said only 29% of US consumers trust their media, which was the lowest out of the 46 countries that were included in a recent Reuters that were studied in that poll. Ms. Lyons was nice enough to provide some follow-up information in this week's Surrey County Record about some of my comments made last week about vaccines not being approved. And in a separate article, the Surrey County Record said that all 3 vaccines have been approved as boosters. So what does approved mean? Approved to be as boosters, but they're still emergency use authorization status. And when I went to the CDC, actually it was the FDA website, and pulled the fact sheets, and these were updated October 28, 2021, the J&J vaccine says within the fact sheet, the Janssen COVID-19 vaccine is an unapproved vaccine that may prevent COVID-19. That's at the bottom of page 1. Later in that, it says, it is your choice to receive or not receive the Janssen COVID-19 vaccine. Should you decide not to receive it, it will not change your standard medical care, end quote. But it could change your employment status. You could be fired for something that shouldn't change your standard medical care. Moderna, same thing. The Moderna COVID-19 vaccine is an unapproved vaccine that may prevent COVID-19, top of page 2. It is your choice to receive or not receive the Moderna COVID-19 vaccine. Should you decide not to receive it, it will not change your standard medical care. End of my quote, but it could change your employment status. You could be fired for that. Pfizer is where it gets a little bit confusing because there's 2 vaccines. One is approved, one is emergency use authorization. The approved one's not available. The EUA one is, and we're to believe that it's close enough. Maybe it is, maybe it isn't. But if it's the same, why didn't they approve the EUA vaccine? It's very fishy to me, and I think the reason that the trust of the media is so low is maybe why our trust of public health is so low. In Washington, D.C. today, Senator Ron Johnson conducted another discussion and invited drug company reps, federal health agencies, and big media to come. They didn't show up. Who did show up? Some of the new alternative media showed up, including thehighwire.com. You can go right now. Anybody who can hear my voice can go to thehighwire.com and see the full length of this. And if you look there, if you take the hands off of your eyes and you look for some information about the vaccine, you will be amazed at the stories you see. These are people who have been injured. I'll wrap up. These are people who have been injured. These are health professionals, scientists. Some are both. Some are health professionals who wanted the vaccine, got it, and got injured. Let's open our eyes. Let's do better for Surrey County.
Thank you. Okay, can I have, has everybody had a chance to read the minutes of last month's meeting? If so,
I would have moved to approve, Mr. Chairman.
I'll second that.
motion by Mr. Olson, second by Mr. Schuman. Comments? Everybody in favor, say aye.
Aye.
Everybody opposed, nay. Motion's passed. Okay, committee reports. Ms. Boucher here.
No, but I can take on something. True.
Okay, I'll give you 3 minutes.
Recently out at LCO, we've had a sudden surge in COVID cases. Through our health center, and our public health official has recommended that we shut down our Head Start and our daycare facility for 10 days, which we've done starting starting Monday.
Daycare
So-
center, and what was the other?
Head Start.
Head Start.
Head Start, early Head Start, due to the sudden surge in COVID cases. So just to try to keep our children safe and the grandparents that are watching these kids. So with that, that's the LCO report.
Thank you.
Mr. Schuman, this is Supervisor Pettit. Isn't there a third entity that's shut down also?
No, we didn't shut down our school. Just pretty much Head Start, early Head Start, and daycare.
Okay, thank you.
Okay, is Joey here online?
No.
Okay. Seeing the Research Center report, Joey,
I'm here, Dale.
go
Okay,
ahead.
can everybody hear me? Okay, the first thing on my report is the 8521 grant. Our numbers are pretty steady. If you look at section B, our large numbers that our bus is used for on the one-way trips is first is nutrition, those people coming to lunch at the senior center in Hayward, and then medical, and then employment. A lot of the employment is we have 4 participants that we take for employment to ventures 4 days a week. But our large numbers are medical and nutrition at this time. And then the social recreational are those individuals that attend fitness classes and other things that Jody does here, and then personal business. As far as our meal counts, they're pretty steady. The averages are right at 152 for all sites, which has been kind of consistent. They've gone up a little bit when some of our sites opened up for in-house dining and stuff like that, but they're pretty much staying pretty steady at that point. The one thing that I want to talk about when it comes to the meal counts is we did our cost analysis for GWAR for what it costs to do our meals. We only did it for 6 months. A lot of it has to do with COVID, what they were looking at. Right now, we are asking for a $5 donation for our meals. With that cost analysis, looking at the total number of home delivered meals for 6 months was 11,609 meals. What it costs us to make that meal that we asked a donation of $5 for is $10.49. That's $5.49 above what the suggested donation is. So right now we're looking at about, it's 29% of the cost of the meals to put together is the labor cost, and 24% is the food cost. And you break that down a little bit more, the total amount for meal service, that's putting the meal together, all of that is 88% of the budget. And then the management and support is 12%. And if you break that down a little farther, the food costs alone is 37% of our budget. The labor cost is 45%. And then the remaining amount of 18% is for all those other things that go along with it. So you can see that the cost of labor is higher than the actual cost of food. And right now our food budget is going up about 20 to 25% each month. When I look at the budgets that we have for each site, they're averaging between $175 and $225 more a month for our food costs. We're also facing right now a lot of the things that we need for our meals will again be scarce. We're trying to buy ahead. But again, what has happened in the past, like last winter with COVID, we'll be doing a lot of more low-cost meals. You won't see a lot of ham. You won't see a lot of turkey. You won't see a lot of beef. You'll see ground beef and stuff like that. Right now, fish is not, we're not able to buy fish at all. You'll start to notice with some of your restaurants, I've talked to a couple of restaurant owners, and they're hoping that they get their fish for this Friday's fish fry, which is very doubtful. 2 weeks ago, we had fish on the menu. Luckily, I personally had bought some fish, hadn't taken it home. So we used it at one of the sites and we were still 10 meals short with fish. So things like fish, pork, fresh pork, turkeys, those kinds of things are getting scarce all the time. I think when I ordered hams for everybody 3 weeks ago and ordered them again 2 weeks ago, the 2 hams that come in a case went up $25.32. So the price of things are going up. So this $10.49, I would say when we do the next analysis, is going to be a little bit higher than that. One of the other things that we're looking at, the Finance Committee has recommended someone for our website design and our computer upgrade. So we'll be discussing that and finalizing that at our next regular SRC board meeting. So we will have a new website, and 3 of our computers will be upgraded at the senior center. Okay. We still have site manager's position open in winter. We have 2 pending applications right now. We have 1 person that we're checking their references, and then they'll be called in for an interview. And we have another person that is interested in the job who has been sent an application. Both of them have cooking experience, so we're just waiting on references and interviews. We still need assistant cooks at Stone Lake and Exlin. We still need a janitor in Hayward. We need a bus attendant and sub drivers. We have our sub driver on Monday who will be going away for 3 months this winter. So we need to find a sub for him because our regular bus driver can't work 5 days a week, 9 hours a day. And we are in desperate need at all of our sites for Meals on Wheels drivers. It's only Tuesday and I've already delivered meals today, and there's a potential that I'm going to deliver meals at least 1 or 2 more days this week. We have people that don't drive in the winter. We have 2 people out on medical leave. We've combined some of our routes. So instead of having 5 routes, we're down to 3 routes now. So, and there's a time frame in which we like to have those meals out so they stay hot and are at the correct temperature. So that's about an hour and a half. And some of our routes are just going over that hour and a half. So we need Meals on Wheels drivers. So if you know of anybody that wants to drive meals, have them call any one of the senior centers, because all of our senior sites need Meals on Wheels drivers. The other thing in your packet is the options for the winter meal site. This was put together by myself and Pan Van Camp from Guar. We presented last week option A and option B for winter. Option A, I'll just kind of summarize them. It would be until we have a full-time cook hired and that person is trained. The meals would be Tuesdays and Thursdays, very similar to what Hayward is doing right now with the Spider Lake. We go out there on Mondays and Thursdays and bring meals. We do the same thing in winter until it was up and running. So they would get meals on Tuesdays and Thursdays. They would be delivered from Exxon at this time until it's opened and we have a site manager there. Option B would be that we provide home delivered meals and carry out meals only, and it would be up to the winter area. If they wanted to have a site and have social activities and stuff like that, that would be on their, their wishes, what they wanted to do. But for option B we would just be doing home delivered and carry out meals that we've been doing since COVID started, versus A, doing meals Tuesdays and Thursdays and then expanding as we had people hired. The thing that everybody has to understand right now with COVID, none of our sites are doing any social activities whatsoever. There is no card playing. There is no one staying after lunch, playing cards, playing games, doing social activities. And that has a lot to do, and it has everything to do with COVID because we're in the red. And like Tweet had said, we need to protect our elders and the people that we serve. Right now we have a board member who won't be at our board meeting tomorrow because they're quarantined because COVID. We've had Meals on Wheels drivers that have had to not be able to work because of COVID and stuff like that. We've been very fortunate that none of our staff has had to quarantine because of COVID, but we've had to deal with it, whether it be someone we're delivering meals to or a Meals on Wheels driver, and now we have a board member. So we have to be very careful what we do and make sure what we're doing is we're protecting those people that we serve. Because last year we served over 30-some thousand meals, and It's very important that those people continue to get their meals. So that's what we're looking at for winter right now, are those two proposals. And we have a special board meeting tomorrow night at 5:30 at the senior center. And at that time, those options will be discussed and the board may make action on what they decide to do with option A or option B.
Okay, thank you, Joy. Does anybody?
Olson.
Beg pardon?
Mr. Olson.
Okay, does anybody here on the board have any questions? Okay, Mr. Olson, you have a question?
Maybe not questions, but comments or possibly questions for Ms. Johnson, who I think is doing a fantastic job. And I'm so appreciative of her for taking this over. Ms. Johnson, fish donations, is that a possibility?
We get donations from the DNR, and here's the thing. If we take a donation of food, we can either do it from the DNR or the venison thing, but we can't take it from you if you go fishing to get the fish, because it has to be processed in a certified processor. So that's our big thing. You know, like I've got someone bringing in some turkeys tomorrow, or they're frozen turkeys that they bought at a grocery store. That's something different because they've been graded and all of that. But we can't, like, say, for example, one of my 4-H kids wanted to donate, you know, their pig and butcher it themselves. We can't take it. Everything has to be certified.
Okay,
I mean, it's
so,
great, you know, if you do it, but we can't accept it.
so we have Whiskey Ridge as one of our accepted processors here.
Right, and we do get some of our products from them.
All right, so we do have the venison donation program through the county. It does run through the county. It's a DNR project, and you know they actually had it on the news, on Duluth News this week. But you know, I guess in my mind's eye, I'd rather see that go to the senior center than I would to the shelters. That's just my own personal opinion, whether it's good, bad, or indifferent. You know, we can certainly do that and make sure that people that venison hamburgers available, and they want everything ground when it goes through that DNR venison donation program. If we did something for fish donation and ran it through Whiskey Ridge, would that be something that would help out the senior center in any way?
It might, and it's an option. I can talk to Pam Van Camp, our state nutrition person, and ask if, you know, if the fish was caught and was processed at Whiskey Ridge, which is a certified processor, I can most certainly ask Pam that question. I'm going to be talking to her tomorrow. So
I know they've ground northerns into fish patties during the Treelands Northern Challenge, or maybe not Treelands, but there's a Northern Challenge where they go out and catch northerns, and they have to keep them, and they grind them into fish patties, and they're available through the food pantry program. I think if we said we could bring fish in for the senior centers, I think we could do really, really, really well. If that's something
I'll tell you though, yeah, Dale, they don't like the fish patties. We've tried it. They'd rather have the fresh fish. They don't like the fish patties. And I can tell you that because one day we took fish patties to all the sites and they said, thank you, but no, thank you. We're not eating them. I mean, some of them will, but they, you know, they just, and we have one site that when fish is on the menu, the numbers are really low. They don't, you know, and believe it or not, it's one of our areas where there's a lot of lakes and they fish. They don't want fish for lunch.
All right. Thank you, Joe.
They don't like the fish patties.
Thank you so much.
You're welcome.
Comments? Okay, part 8, administration. Adult long-term care.
Okay, you have Lori Perlick's report submitted for your review. I want to add something that's not on there. I think it's been talked about at a previous meeting. The ADRC of the North from the state got 2 extra half-time dementia care specialists. And what the ADRC decided to do with we already have one halftime one, so now we have 3 halftime DCSs. So what's gonna happen and what is happening is Ashland and Bayfield County, I believe, are gonna share the existing dementia care specialist. Iron and Price County are gonna share one of the new ones, and Sora County is gonna have the other halftime one. And what we did, we agree with the ADRC, and it's paid for by the ADRC. We're gonna combine that halftime position with our halftime open information and assistance specialist position within the ADRC, hopefully to get a better shot at getting somebody recruited for that position. So that's a good thing for Sora County.
Questions? Behavioral health report.
Okay, you have Alicia D. Carlson's report submitted to you. I want to highlight something that's incomplete in there because this was fresh after she submitted it. They have made significant progress on the electronic healthcare record system, and they work with the provider, and they got all the forms submitted to them, and now they're going to have some coaching sessions for the next month, and then it should be up and running, I think, in about another month or so. And believe it or not, that the staff is excited about that.
Almost.
Well, yeah, we know. Well, yeah.
I got a question, yes. Alicia, does your budget seem to be right where it should be and you projected the right numbers for 21? Is that how it's coming out? Maybe Patty can jump in. It's all these
I don't
programs.
really know. I don't really know because we've still got another 2 months of holidays. It's numbers can go down, numbers can go up. This is the worst time of the year.
We also lost staff,
Yeah.
so we're down in the staff they're holding into the program.
Okay. Mental health costs.
You have that report submitted here too.
Okay.
Usual one.
Active services, CPS report.
Okay, it's been talked about in previous meetings, and I listened to the last one when Patty gave the report. Thank you, Patty. As you know, the CPS Child Welfare Unit is really under duress, under stress, because they're just like half staffed at this point. And for, it seems like forever, maybe a year, I have no idea, but it seems like forever that we've been triaging services there. Alicia and her staff have helped out triaging that stuff. And then Carla May Kay, the CPS supervisor, has really stepped up and taken a leadership role on that unit, as well as one of her supervisees, Julie Concannon. And lots of conversations with Tom and Rose. What we've decided to do is Carla May Kay is going to be the supervisor for CPS and YJ. She's got command of it right now, is doing a great job. So her title will be Child, Youth, and Family Services Supervisor, which is a common title and a common position for these smaller counties in the Northwoods. That doesn't mean they're still not under stress dealing with stuff, but they've been doing the best they can in prioritizing cases both in CPS and YJ. We also had, I don't think this happened during the last meeting, but we had our social services aide resign. And there's another opening, but she has agreed to stay on halftime until we're able to fill that position.
Okay. And you covered youth justice there?
Yeah, and there's a report on there too, a caseload report.
Okay. Economic support?
Economic support just keeps plugging along and doing what they need to do, and they're hitting high service rates, as you can see, in the upper 90s.
Public health?
There we go.
rate still is plateaued at a red level there, as we can see. And we've been hoping to see those numbers come down by now. Just can't seem to get to that. We were hoping once we got about 2 months in, we'd really start to see that drop. So still have our fingers crossed. I know we've been talking with LCO Health Center on this. We're all looking forward to those numbers dropping.
Julie, how do we compare with the rest of the state?
We are in the top 5 of the counties for transmission. What we're seeing is some of the southern counties that are starting to lighten up a little bit. And that's kind of the progression of how it really spread. It started with that area, got a little bit higher, and then we tend to lag a little bit. So that's what we're looking at.
Are most of the counties still just highly recommending masking or any mandated masking or anything like that?
I am not aware of any. Maybe Milwaukee or Dane might have some mandating on masking, but as far as I know, nobody else does. And this is just our data, again, showing the transmission. This is from the CDC side of it. And then case spread for age distribution. I know this was asked about in the past. And so we were able to do a poll of our Sawyer County cases. So as we know, July was looking really, really good. August was looking pretty good, and then you can see September has jumped up. We are going to just pull this data once or each month, and we'll pull it around the 15th of the month. That allows us to get, or the 15th, so October, we'll pull it around November 15th. That allows us to get all of the cases in, and we get the onset date with that. Some things that are going very good is our contact tracing team. We do some measurements from counties to counties and statewide, and it's the percent of interviews that can be completed within 2 days of us being notified of them. The blue line is our county, and the green line, or minty color, is the statewide average. So definitely our team is really rocking it. So, and so with the contact tracing calls, a lot of it's getting out information, sharing what the recommendations are, and answering questions. So. I just showed this at the county boards. Most of you have seen this already. We just go from month to month. This is something that's released by the state. A request was put in that we try to get one that is fully vaccinated, partially vaccinated, and not vaccinated. The request has gone in. I'm not sure that the state will honor that request, and I'm not going to be able to pull this data this way. I show this every month just to kind of show that there really has not been any shift in the variant. People tend to ask me if there's been shifts, so this one's on. Hospital capacity, as you can see, this one is just really showing COVID cases in the hospital. And Dr. Dunlap last month had commented on how crazy things are. It has been, over the last few weeks, really, really busy for the hospital systems, and it's not COVID related. They're coming, it's a lot of different things going on right now. So our healthcare centers are definitely feeling it. So if you see somebody who works in the hospital, give them a pat on the back, because it's been really crazy for everybody.
Is it true, Julia, that the ICU units are busier because we can't transport out because the other facilities are full?
Everybody's full. We're looking for spaces to send people to today. And this actually fluctuates throughout the day. But so today when I looked at the ICU available beds, there was 3 that would be readily available. And you know, those can get eaten up really fast at that particular hospital, let alone us kind of saying we need a bed and we want to transfer somebody to it. We get the transfer done and all that. So yep, so pretty tight there. For community testing, we have a new testing site location. The Wisconsin National Guard has been called up and has been helping out sites. We have been able to open a site in winter, which will start tomorrow. We used to have it at the fire hall, but we will be shifting to Zion Lutheran Church because the fire hall is full of trucks. So we can't do a drive-through there now. Zion Lutheran Church has stepped up and is allowing us to do a drive-through. And if you guys recall, that's the one that's right on 70. And there's like a little roundabout in there. So we should be able to keep the National Guard warm. They can come out, do the testing, and then people can go on their way. There is no appointments needed for this. Oh, and I did not write the times. The time is every Wednesday from 10 until 1. That will be November 3rd through December 8th at this time, unless the National Guard has been extended, but at this point, that is the length of it. There is no appointments needed. There is no charge. People are to register with COVID Connect, and they can do that at the site as well. And then these are going to be PCR send-outs only. So, and usually those are about 2 to 3 days to get results. The Hayward Site has been going well. We're starting to get a little bit busier. We are looking at getting that COVID cabin that the hospital had, so we're just working out the final details on that. We'll be able to move that over. That should really help with the flow. And if you think about 63 on that, for the Oasis building area, there is a nice area where you could drive in one side and drive out the next. So we're hoping that that will work out for us, especially being that we do vaccine clinics there twice a week as well. We are able to do antigen testing, which is a rapid test at the site, and then have PCR send out with that. We are only able to do that because we received some kits from the hospital. We'll try to do some purchasing of kits, but that is something that the state does not give us. So we'll be working with our monies on that. We do request an appointment, and then we do have people sign up with COVID Connect because that is how they get their results. And then just age yes, that is what I was trying to say. Age distribution on vaccination rates for Sawyer County. This is pulled from CDC, and this is as of yesterday. And then, oops, I'm sorry. Go ahead.
Well, I just want to add that had a conversation with Patty today, and clerical is just getting inundated with calls. And so she's had us kind of reorganize a little bit with her staff, correct? I mean, just really tons of phone calls.
And a lot of phone calls, people wanting to get in. And Michelle has really taken the brunt of those. And so we've been working with her and Reggie, and I think the other staff are going to do some training. Things change really quickly, and that is very difficult on clerical because we're responding and then they're needing to respond. And really the difficult part, more difficult, is they're not in the throes of it like the nurses are, so they get kind of the language and the lingo. And I think that makes it difficult on clerical as well. And they are actually doing both the vaccine appointments and the testing appointments. So really adding all of that. Yes, Patty.
Well, I was just going to say that another issue comes up with that people go on the CDC website and they hear things and start calling in and asking questions about that. So that is another layer of calls. So it's been pretty inundated, and I've had to triage for my staff a little bit to try to make sure that they're not way overwhelmed. Because if you all remember what I said last month, that we did reorganize 2 positions to try to help all the other units that have not been able to hire staff. So my unit is also down in staffing, and now we are, I have to say that in the last week, Michelle, it's over doubled the workload.
Mm-hmm.
It's pretty dramatic. And again, it keeps changing. What we need to say and do keeps changing daily, which even exacerbates it because it's hard to keep the backup staff trained.
Everybody's very appreciative. including all of the residents that are calling to get vaccinated or tested. We do, and the big shift was really when Moderna and J&J became available. That big push happened again with a lot of phone calls. So lots coming in for that. And then Pfizer, actually, I should have said Pfizer did seek approval for the 5 to 11-year-olds. They have received FDA authorized emergency use. Then after that, the ACEP meets, which is the Advisory Committee on Immunization Practices, that's run through the CDC, and they give vaccination guidance. Today they did meet and they did approve to move forward with that. So there comes some more phone calls. I was just on here before I came because I saw it in the media releases at least. So I'm assuming that other people will be looking for that. Right now we're working on a vaccine distribution plan for that. Most likely with the 5 to 11-year-olds, we will be offering something after school where parents can bring the kids if they want to sign up for that. We'll work through the school to find out, make sure parents are aware of it. If they want it, they'll know how to get it. We'll set up a couple times. LCO Health Center will also be working with the LCO school for this piece, and then we share vaccine with LCO Health Center, which is excellent because Dr. Steve has already placed the orders for us, and then when we need vaccine and we get calls on that, then we just work with them to get our vaccine, and that's how we distribute it. So I anticipate hopefully being able to offer this before Thanksgiving. We're hoping that we can get some dates set up. We know that there'll be some families that are very interested and have been calling and asking when this is going to happen. So that's
Is Pfizer the only brand that's been approved for the 5 to 11-year-olds?
yes.
Same dose as the adult?
No, actually, and that's the other piece of it. It is a smaller dose. So that will come in a different vial as well. So it wasn't as easy when like Pfizer booster came out, it's the exact same dose. There is no change in that, but this dose is going to be less for the 5 to 11-year-olds. So we want to make sure, because that's, if you recall early on, I don't know if I've talked about this lately, but Pfizer is one that you have to reconstitute. So it comes in a powder and then we add liquid to it and we reconstitute it. You need to do that correctly. And so there'll be some slight changes for the 5 to 11-year-olds. So we just want to make sure that we take our time and train all our staff up before we get out there and do that. And the other thing, we'll probably keep our younger kids separate. We want to make sure that we are not having any risk for errors. So we don't want to have adult vaccine and child vaccine in the same room. So we'll be having separate vaccinators and doing separate clinics. So that is the plan.
Any more questions for anybody online? Okay. I've got a couple of things I'm just curious about, really. Is the problem that our hospital beds are full, or we don't have the staff to take care of the patients if they were full?
So here, I'm not hearing that there's really a lot of shortage in staffing, and that's something that I can reach out to Luke on to validate. It's mainly that there's shortage on staffing in other hospitals where physically they have more beds there, but they just don't have the staff to pull in. So we do see this at certain times of the year where census really gets pushed. This is not uncommon. This is not a only COVID time related phenomenon that's happens. It usually happens during flu season. Nurses are mandated to work longer hours and stay on longer so that we can have more staffed beds. Very common to happen. It happens to be happening right now, and it adds a lot of stress to the system.
And I understand that hospital staff here in Hayward are mandated to be vaccinated?
I do not believe I did not hear that this week. When did I talk? On Monday, I asked, they do not have a mandate for the hospital staff at this
Okay.
point.
Okay,
I might have missed one, but
I think Essential Health does though, right?
Essential Health
And
has
the
four.
LCO clinic mandated
Mhm. And I,
with exemptions.
with it.
Yeah.
okay. And are we, Sawyer County, with all these vaccinations taking place, are we getting closer or close to a herd immunity?
We're getting there. We should be at, let's see, we were 62 or 63% just with vaccine alone, plus we add in people that have already had acquired COVID. So we've got to be close to 65, 66, 67%. It's a rough guess because I'm sure there's been more COVID cases that we don't know about. So we hope that that number is actually higher than what we see the numbers on.
What is the magic number?
Well, with COVID, they believe it's really up into the 80s. Normally, we would say about 70% is herd immunity.
Yeah,
Because this transfers about as quickly as chickenpox, it ends up making it where you need to have more people acquire immunity than if it was something that didn't spread as easily. So,
thank
so
you.
hopefully our numbers, we get through this and our numbers shift down and we can kind of, and we'll most likely have an endemic. So, you know, we'll have some high times and then some low times. COVID won't go away.
No,
It's going to be here. It'll be
Neither-
more like an influenza
neither
season.
is influenza.
Mhm.
Okay, thank you.
Mhm.
You see, Mr. Olson?
Oh.
You got something else to add? Julie?
No, I'm done.
Mr. Olson?
Thank you, Mr. Chairman. Ms. Lyons, never think that I or anybody else is saying that you're not doing a good job, because you're doing a fantastic job in the face of what you have to deal with. I'm appreciative, and I think everybody is. I would like, though, when we talk about numbers, I'm a quantitative guy. I'm not a qualitative guy. So when we talk about the National Guard coming to test in winter, we're talking about the Oasis building being opened up for testing. I'd like actual numbers. Is it 3 people? Is it 5 per week? Is it 200 per week? If you could actually give us like real numbers, that'd be fantastic. I'm actually a little appalled by a couple of things I heard tonight. Number one, you know, when we're talking about approval of this for younger kids, we should make absolute positively certain that there's parental permission for kids to get these shots.
Yep.
And
And I just want, I'm sorry to interrupt, but I want to validate, we are not doing this in the schools. We are doing this with parents. Parents are bringing their kids in.
that's fantastic for them. I just want to make sure that kids aren't doing this under peer pressure, because having raised a couple of kids through adulthood by myself, kids are stupid and they'll do stuff for just idiotic reasons sometimes. At the same time, great for you that you're doing that. And I also heard from Supervisor Schuman tonight that there was a surge of COVID cases in the Head Start and early Head Start, which I'm assuming is age 5 and under. And I thought that these kids were not being affected in that manner. That was kind of what we were led to believe early on in this. I certainly haven't heard that. I haven't seen that. Is this the case that our 5 and unders are being that highly infected by this virus that we have to close things down?
Did you want to answer?
Yeah, it's mainly Mr. Olson, it's mainly the staff. We had many of the caretakers and staff that have come down with COVID. And through contact tracing, we had to quarantine, you know, the majority of the staff. So we didn't have enough staff to operate the Head Start or daycare.
So, because you said, you know, you're looking out for the grandparents that are watching these kids, was what you said. And so you're just thinking the little kids are going to drag the staff's virus back to the grandparents.
Correct.
Okay. All right. Well, that makes a whole lot more sense, because we really haven't seen those little kids getting this virus.
We do have some case, we have more now than we had before Delta. So
Okay.
you're right, early
Okay,
on.
we need quantitative rather than
Well, I
qualitative.
had the numbers up, I'll have to pull them back. Hold on.
I took a picture.
Okay, so there, do you have it? Okay. So we are seeing, and I can do the comparison if you want to see that difference. We're seeing more. It's not nearly what we see with the older population.
Yeah, and you know, having that gap of 0 to 9 and 10 to 19, the difference between a 5-year-old and a 19-year-old, massive. You know, so I understand.
And I can't give you data down really tight numbers. The smaller we go, the more we run into a HIPAA risk. So we have to be really careful about that.
I understand that, but hey, thank you for all you're doing. Appreciate it.
You're welcome.
Ms. Pettit.
Oh, Ms. Pettit?
Ms. Pettit, go ahead.
Thank you. First off, I would, as a COVID-19 coordinator for the LCO Ojibwe College, I would like to make the board aware, and Mr. Schuman is aware because he is on the tribal governing board. We've had a tremendous amount of loss in the past week within the LCO tribal community. What is happening is the parents are attending funerals and going to gatherings where fires are burnt all night long. They're out and about. Families are gathering for the loss of their loved ones. So the adults are interacting, and then that's what's happening, and it's being spread across the tribal community. It has been, and I would ask that every single one of anybody that sits on this HHS committee should go to the CDC or the DHS website, and the numbers are all there. It's posted daily, every day, for every state you need to know and what's going on. The age group that we are discussing has seen a significant amount of increase because adults now are having breakthrough cases, and the kids, as we know, the Delta variant is spreading, as Ms. Lyons said, like chicken pox. So this is what's going to happen when you've been vaccinated, and now vaccinations, immunity is coming off. The antibodies have depleted within our bodies, and that's why the boosters have come out. But Ms. Lyons does not control the numbers. Ms. Lyons has only given the numbers that she can get from the state. It is very hard for her to manipulate the numbers for the county. As she said, many people do not report that they are positive. They will not report that they were a close contact. It is very, very difficult, her job. And I give her a big kudos for it. But I would suggest that the board members that sit on this committee go to the CDC and the DHS. You will find a lot of important information there. And the age group that is going through right now is the age group Ms. Lyons is discussing. And as a parent in Sawyer County, I know that there is no way a doctor would let a child say, yes, I'm going to take the shot at school, or a nurse. None of them would ever do that because the lawsuits would fly like wildfire. That's all I have to say.
Okay, one thing just for the record, Julia does not manipulate the numbers. She manages them and organizes them, so it's understandable for us.
That is not what I said, Chairman. I said that she cannot manipulate the numbers. She does not have that. She gets what she gets. In no way did I implicate she manipulated.
Everybody. read the-
Chairman, I'm sorry, I was on mute. I did not state that Ms. Lyons manipulates numbers. I said she cannot manipulate the numbers, so that is what she has. In no way would I suggest she would manipulate numbers for the county.
Okay. Budget performance report, everybody's got those.
Yeah.
Purchase, we've got that. Purchase services. Updated budget discussion 2022.
Well, the budget is in the hands of the board, so you can discuss anything you would like as it pertains to this committee or the entire budget, if you so choose.
Anybody have any questions or
I-
concerns specifically about the budget?
Yeah, Patty, can you help us with this? I see Winnebago and out of county placements are headed to 1.3 million, I think, for this year.
Yes.
Did I see that? And what did we
Yeah.
budget? What did we budget? for
We
that?
budgeted correctly for next year. We added in to budget what we are projecting.
So
You'll see an increase in our budget, and then after the first time that we submitted our meeting, Tom and Mike Keefe met with us and had us increase our Winnebago cost to get it. I believe it's a very realistic budget.
how far did we miss the 21? Do you think we're gonna be
Well,
a couple 100,000 or more?
okay, that is really hard to say at this point in time, okay? Through September, we have spent in 5 months, $583,000 in Winnebago, and we only budgeted 600,000. Okay, but we are, as Paul has been saying, very short-staffed, and we haven't been able to fill those positions. So that we have that money for where we're over. We're also very over on out-of-home placement costs for children. And that is in a direct correlation to the less staff you have, the more that those go up, as Carla has said. So it's next to impossible for us to, at this point in time, make a projection on it. We can project out, divide by 5, multiply by 12. But we do have other people going into Winnebago for short-term stays on a continual basis also, because there is no, as Julia has said, there are no hospitals anywhere. So it is Winnebago totally, when we have to even have anybody in there for short-term stays.
Is there anybody else here? Mr. Olson?
Thank you, Mr. Chairman. I've been doing county politics and everything else for about 35 years. When Patty says this is a realistic budget, I absolutely agree that this is a realistic budget. We may not like it, we may not agree with it, but it is a realistic budget. I am probably the one guy that doesn't believe whole hog and out of home placements because, grandpa and grandma watching the kids while mom and dad are doing something else. No, I'm not going to be in favor of that ever. But at the same time, I think Patty has done, and Paul, Mr. Grahovic, excuse me, a fabulous job in what they've done. And we are now actually, with the Winnebago money going in there, we're actually realistic. Instead of budgeting 0, which we did for many, many, many years, now we're budgeting a realistic amount. Fantastic. And thank you. And I don't think this budget is a question when it goes to the county board next week. I think that this is exactly what it should be. Thank you guys for doing all you do.
But we're not, sorry, Mr. Chairman, we're not balanced, are we, Tom?
No, we recognize the expense that we're incurring in those costs. And then, as we talked about, it's augmented with tax levy and fund balance. So we do have fund balance to balance this portion of the budget because of those added costs. But it does recognize the expenses that are being incurred.
And at some point, the fund balance will run out.
Absolutely. Yes.
Like this is our last year.
Yep.
Right, Carol?
This is our last year.
So where are we gonna find the 40,000 we gave Hayward Site Visitor Bureau when we were balanced when you brought that in? Is that a good question? We're talking budget.
It's a legitimate question.
What have
yes.
the other committees decided?
There was a motion made in economic development to augment the Visitors Bureau budget with ARPA funds, and tourism would qualify for ARPA funds if the board was so inclined. So that's that was a motion that came out of economic development and be presented to the board, along with anything else that comes out of the other committees.
But that's not sustainable, right? That's just.
That would get us through this year. Yeah, the ARPA funds, you know, you're gonna use this year, next year for various purposes. So that is one of the eligible expenses. It doesn't, you know, we don't want to get into funding operating activity with those ARPA funds because that's not going to work in the long run.
Okay,
I'll go again if nobody else has it. Chuck has something, I think.
Chuck?
Fund balance, not fun, right? I think you corrected me on that one. So is this the only thing out of everything that we messed up as a board when we changed that, the $50,000 or 40,000 or whatever it was? Is that the only thing that is messing us up from being within? Or is there something else?
No, that's the only thing. The only change that was made to the administrator's budget was that change so far. Yes.
So we would have balanced.
Yes.
Okay. Future agenda.
I got one more.
And then Ms. Pettit.
What? Who?
Ms. Pettit.
She should go first, Chairman.
Go ahead, Ms. Bennett.
Mr. Hoff, isn't it still viable that there are going to be other things possibly down the pipeline with the budget? That we will be beyond that $40,000, correct? Isn't that was brought up in the board meeting on Thursday? There's a possibility?
Yes, and that was addressed in a special public safety meeting
Yes.
today.
Mm-hmm.
And so, yeah, there is a potential of that depending on that agreement and how that works out.
Okay, so that would lead us about $90,000, right?
Yes.
Okay. Thank you.
Mr. Olson, is this again?
Mr. Olson?
Just when we're talking about budget, you know, we're borrowing $1.3 million, quibbling about a couple tens of thousands, maybe 100,000. I'm not going to do it when we're borrowing $1.3 million against our grandkids and kids and future generations. I'm against the whole borrowing because we never even looked at anything to cut. So, you know, is what it is. You guys, we all pick what we want to pick here, and we did. So I think this budget is pretty darn good. Thanks, Patty.
Okay. Anybody else? Ms. Pettit?
Yes, when it comes to the budget, when we talk about $100,000, if that's $100,000 that we cannot cut anywhere else in HHS or anywhere else. So we're going to have to look to figure out where it's possibly going to come from, which it would probably be the list where the libraries are at, where Hayward Lakes is at. There was something else on there. There's EDC was on there. Across the board, those are entities that my understanding were supposed to eventually stand on their own, and the county wasn't going to fund them forever. So before we cut anything from any of our budgets within HHS or any other department, that is where, if we have to come up with $100,000, that is where we should be looking. HHS can have nothing cut from it. Absolutely not, especially with what is going on in the tribal community with overdoses, addiction, housing, all of it. We can't cut anything else from this budget. We have so many children that are in foster care, they're out of placement, their grandparents are raising them because their parents are having alcoholism, addiction issues. This is why I've been pushing about mental health and rehab facilities. So we can't take from programs that are already cut to the limit. We have to then look to where we're giving from the county to sustain or help out some of these people. And that's where I'm at it. It's not where I'm at. $100,000. Yes, we are borrowing. We're borrowing against capital like every other county is doing right now because of COVID, because of how Winnebago issues, mental health, because small counties like ourselves are overwhelmed. We cannot afford to continue to do this. And that's why we've asked at the Capitol to say we need help. There have been counties that have declared bankruptcy because of these issues. Don't want to do that. Don't even want to bring that up. But what are we going to do when the money runs out? We have no fund balance, no nothing. There's nothing in the coffer come next year. We can't cut anything else. That's all I got.
Okay, thank you.
I go get her, yep. Tom, what do we do with all the excess land sale money that came in or is coming in this year? I think we budgeted 50,000. I think almost 400,000 is coming.
Yeah, as we discussed at the board meeting last week, that rolls into fund balance. So it increases our fund balance and is available, in future.
To fill gaps.
Yeah.
What about the opioid money that could be coming? Any idea when and how much?
We should have something at the December board meeting about the opioid allocation for all the sub-entities, including counties in Wisconsin. So we're awaiting information from the Attorney General office on, that formula that they've been working on. There was legislation passed prior that allocates 70% of the total allocated to Wisconsin to counties directly, because we're the ones who are going to have to, deal with the issue. So that was a very good thing that happened in Wisconsin that didn't happen in a lot of other states. So we're in a really good position to get money where it's needed at the county level. We just don't know what our allocation is, but we should hear that by December, because as the board need to pass that you're going to accept that settlement before January something. It's before the January board meeting, so I think we have to do that in December.
Okay, one more question on the budget. We're getting into what should really be a board discussion now, kind of out of the concept of health and human services. So go ahead, Mr. Olson.
You're absolutely right, Mr. Chairman, but as long as we've gone down the rabbit hole this far, then why are we selling our carbon credits now?
We are looking at the potential of selling carbon credits. It's a relatively new idea through some of the forestry. Some of the counties are doing that this year. It's kind of a new concept, a new market for those carbon credits. And so I think Greg has got some presentation, Greg Peterson, the forester, tomorrow morning at Land Committee, if you're interested on where that process is at.
Yeah. So why are we doing it now?
because it is available now. There was not a market for it in years past.
Okay, let's move on to future budget
Mr.
items.
Chairman, if I may, I
No.
respectfully, I can.
No. Future agenda items. Okay. Correspondence.
Oh, for future agenda items, Mr. Chairman, what about Oasis? Are we gonna discuss at any time the plans or thoughts of that? Or I know Julie is using it now for her.
Yeah,
clinic
that
things, but-
space.
Yeah,
We need to circle back with Journey to see, if they were looking at maybe using or asking if they could use some of that space. And if they don't, we can market it, we can use it ourselves. And so that'll probably run through Public Works.
Okay.
As far as usage, unless this department has got a specific thing, and Julia will get kicked out at some point.
but she's gonna request it.
Okay, any correspondence reports from conferences or any other matters for discussion? Anybody?
I got one thing that I was remiss in saying about the CPS reorganization with Carla taking on 2 supervisory roles. What's common then is they have a lead worker, and Julie Kincannon is going to be the lead worker. She stepped up in a leadership role. So Carla's going to assume those 2 supervisor positions. And then Julie, you're doing enough. Julie Kincannon's going to be the lead worker. So.
Okay, we're done.